ਪਿਛਲੇ 20 ਸਾਲਾਂ ਤੋਂ ਇਮੀਗ੍ਰੇਸ਼ਨ ਲਾਅ ਦੀ ਪ੍ਰੈਕਟਿਸ ਕਰ ਰਹੇ ਮਾਰਕ ਐਂਡ ਕੰਪਨੀ ਲਾਅ ਕਾਰਪੋਰੇਸ਼ਨ ਤੁਹਾਨੂੰ ਹਰ ਇੱਕ ਕਿਸਮ ਦੀ ਸੇਵਾਵਾਂ ਪ੍ਰਦਾਨ ਕਰਦੇ ਹਨ। ਇਹ ਲਾਅ ਸੁਸਾਇਟੀ ਆਫ BC ਦੇ ਮੈਂਬਰ ਵੀ ਹਨ, ਜਿਸ ਕਾਰਨ ਤੁਹਾਡੇ ਨਾਲ ਧੋਖਾ ਹੋਣ ਦਾ ਸਵਾਲ ਹੀ ਪੈਦਾ ਨਹੀਂ ਹੁੰਦਾ।
मैं स्नेह दे हूँ, मैं पंजाबी हिंदी बोलती हाँ।
ਆਪਣੇ ਰਿਸ਼ਤੇਦਾਰਾਂ ਨੂੰ ਯਕੀਨਨ ਤੌਰ ਤੇ ਕੈਨੇਡਾ ਬੁਲਾਉਣ ਲਈ ਅੱਜ ਹੀ ਲਿੰਡਾ ਮਾਰਕ ਨਾਲ ਗੱਲ ਕਰੋ।
Our commitment to you is our professional services with integrity and dedication.
ਅੱਜ ਹੀ ਫੋਨ ਕਰੋ 604 588 9800। ਸਵਾਗਤ ਕਰਦਾ ਜੀ ਇੱਕ ਵਾਰ ਫਿਰ ਆਪ ਸਭ ਦਾ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ। ਅੱਜ ਦੇ ਸਪੈਸ਼ਲ ਸਿਹਤ ਸੈਗਮੈਂਟ ਵਿੱਚ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਵਾਉਣ ਜਾ ਰਹੇ ਡਾਕਟਰ ਬ੍ਰੈਡ ਮੈਥਿਊਜ਼ ਨਾਲ। ਇਹ ਚਾਈਨੀਜ਼ ਮੈਡੀਸਨ ਦੇ ਪ੍ਰੈਕਟੀਸ਼ਨਰ ਹਨ ਅਤੇ ਇਸ ਤੋਂ ਪਹਿਲਾਂ ਬ੍ਰੇਕ ਤੋਂ ਪਹਿਲਾਂ ਤੁਸੀਂ ਸੁਣਿਆ ਸੀ ਪੁਨੀਤ ਮਰਵਾਹਾ ਨੂੰ, ਜਿਨ੍ਹਾਂ ਨੇ ਕਿ ਸਾਡੇ ਨਾਲ 7 ਐਲੀਮੈਂਟਸ ਆਫ ਨਿਊਟ੍ਰੀਸ਼ਨ ਬਾਰੇ ਗੱਲਬਾਤ ਕੀਤੀ ਸੀ। ਅੱਜ ਡਾਕਟਰ ਬ੍ਰੈਡ ਮੈਥਿਊਜ਼ ਨਾਲ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਾਂਗੇ ਕਿ ਕਾਰਡੀਓਵੈਸਕੂਲਰ ਡਿਜ਼ੀਜ਼ਸ ਅਤੇ ਹੋਰ ਜਿਹੜੀਆਂ ਬਹੁਤ ਸਾਰੀਆਂ ਪ੍ਰੋਬਲਮਸ ਅੱਜ ਸਾਊਥ ਏਸ਼ੀਅਨ ਭਾਈਚਾਰੇ ਦੇ ਵਿੱਚ ਵੇਖੀਆਂ ਜਾ ਰਹੀਆਂ ਨੇ, ਕਿਵੇਂ ਚਾਈਨੀਜ਼ ਮੈਡੀਸਨ ਹੈਲਪ ਕਰ ਸਕਦੀ ਹੈ। ਆਓ ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਡਾਕਟਰ ਬ੍ਰੈਡ ਮੈਥਿਊਜ਼ ਦਾ। ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Thank you very much.
So doctor, like last time you talked about the importance of herbs and how they can help you. Let's talk today about the issue of cardiovascular problems in the South Asians, and especially sugar and high cholesterol and heart attacks and all that. So from what perspective do you see it, and what are the reasons for this?
Well, you bring up a good point. First of all, there are genetic predispositions to certain diseases.
Okay.
Cardiovascular health, diabetes, these are often some genetic predisposition.
Right.
However, diet and lifestyle choices also impact a
Right.
person's overall health. So in those cases, we can address those situations through herb, through diet, through exercise, and that sort of thing.
Okay, and also today if you can let us know a brief history of the Chinese medicinal system. We know, we have heard it's been continuing since ages, but basically, you know, what is the importance of this particular form of system which is in vogue?
Yeah, Chinese medicine has been around for thousands of years. Along with Ayurvedic medicine and Tibetan medicine, it's probably the longest continually practiced medical system in existence still.
Right.
So thousands of years of history. The primary treatment methods that we use in Chinese medicine are herbal medicines, acupuncture, diet, exercise, and Qigong therapies.
Okay,
Yeah.
and when we talk about the herbal medicines, and that's what is emphasized in Ayurveda and the Chinese medicine system, what kind of herbs are used? What are the ingredients of that?
Thousands and thousands of different herbs are used, and they can be plant, mineral, or even animal products.
Right.
The vast majority are plant-based
Okay.
products and include things like on the market that you see today: ginseng, cordyceps, Japanese red reishi, ginger, licorice, and the like.
Okay.
Yeah.
And as I mentioned in the beginning also, that in South Asians, especially the Indo-Canadians, we find a lot of people who are facing cardiovascular problems. So what would be your recommendation to them? What they should incorporate into their daily lifestyle which can help them in the form of herbs or any other thing?
Okay, so first of all, for cardiovascular health, if there is an actual diagnosed condition there, a person really should be seeking the medical advice of a professional. However, exercise is extremely important in cardiovascular health, as is diet.
Right.
In diet, we can talk about herbal medicine as part of a person's diet. And a product like Japanese red reishi, for example, has shown really remarkable effects on cardiovascular health.
Okay.
There are certain components in the mushroom itself that reduce triglycerides, so the cholesterol levels in the blood, reduce the blood pressure itself, so definitely promote better cardiovascular health.
Okay. Another problem is of diabetes, which is a very, very serious issue in our community. Our eating styles, our lifestyle is further, you know, increasing this problem. So if anybody is having diabetes, what they should do from the Chinese medicine perspective?
Okay, so first of all, we need to separate type 1 diabetes from type 2. Type
Okay.
1 being insulin dependent, where a person is requiring oral medication or injection of insulin to manage the blood sugar in the body. Type 2 diabetes, on the other hand, is usually the result of poor lifestyle choices.
Right.
Eating too much sugar, not getting enough exercise, that sort of thing. So nowadays, the first and foremost approach to type 2 diabetes is get a person exercising and eating better. In the event that that's not quite enough, then we can start to incorporate herbal medicine into that as well. So
Okay.
ginseng, for example, Japanese red reishi, again, both very good for diabetes patients.
Okay. I find in your talks you emphasize quite a lot on Japanese red reishi. Why do you think it is such an important herb, and what are the results if we see in the past? Has there been any scientific evidence which proves that this herb is really effective?
Well, for diabetes, for example, there is clinical evidence suggesting right now that it can actually help to promote the cellular growth in the pancreas, right, which is responsible for the release of insulin into the bloodstream, so diabetes. I talk about Japanese red reishi a lot because short of going to a professional like myself, these are products that are available in your health food stores and are generally safe to use. Japanese red reishi was considered a superior herb in ancient China and considered reserved for royalty because of its purported effects on health. So it's a product that can be taken long-term in relatively large doses without real side effects.
So how do you take it basically? And again, when you're looking for a product of reishi, what should be kept in mind that what you are taking is going to have an impact and is going to be really effective on your body?
Good question. Not all products are created equally. Japanese red reishi, for example, look for products from Japan. Look for products that are Ganoderma lucidum, not mycelium. Mycelium uses the stem of the plant. It should be just the fruiting body, just the head of the mushroom. It should be a hot water extract. It should be propagated, grown in wood logs and cultivated that way. And generally the strains coming out of Japan are of the highest quality. They're a dark red color, very bitter tasting.
Okay, and towards the end, any recommendation that who should not take it, and even those who are taking it, what are the signs if in case there is some problem, what they should keep in mind?
Okay, so generally speaking, as I said, these superior products are considered fairly safe for most people. Now, Japanese red reishi has some blood thinning effect. So if a person is taking blood thinners, for example, or high doses of ibuprofen that thins the blood, they should be a little cautious and again seek the advice of a professional. Certain side effects that are reported but rare would be things like skin conditions, rashes, headaches, nausea, dizziness, and that's usually a sign of detox going on in the body, and a person should take a vitamin C source or an antioxidant to help curb that.
Towards the end, as you mentioned about detoxification, does this product also help in detoxification also?
Well, because we're promoting the overall health in the body, it does help to detox. So it helps to clear out some of that toxic substance in the blood, and that's why some people do get these detoxification symptoms.
Great. Thank you very much for your time.
You're welcome.
आज डॉक्टर ब्रैड मैथ्यूज़ ने जी गलबात की थी उसके विच कार्डियोवैस्कुलर और डायबिटीज़ नाल संबंधित बीमारियों बारे इन्होंने जानकारी दी कि यह समस्या जी काफ़ी गंभीर रूप इख्तियार करती जा रही है। साडा खान पीन जो है उस कारण यह समस्यावां वध रही ने, पर नाल ही इन्होंने हर्ब्स का जिक्र करते हुए दस्या कि अज बहुत सारे मार्केट में प्रोडक्ट्स अवेलेबल ने क्योंकि हर्ब्स जोड़े ने प्लांट बेस्ड होंगे ने और इन्हां दा कोई साइड इफेक्ट नहीं होंदा। इन्होंने कहा कि जैपनीज़ रेड रेशी एक ऐसा प्रोडक्ट है जिहड़ा कि ओवरऑल तुहाडी डायबिटीज़ के उत्ते इसके क्लिनिकल एविडेंस भी है कि इसके बेनिफिट्स मिलते हैं। उस तो इलावा कार्डियोवैस्कुलर यानी कि तुहाडी कोई हार्ट की प्रॉब्लम हैगी, कोलेस्ट्रॉल की प्रॉब्लम है, उसनूं भी ये ठीक करने में मदद करता है। पर अखीर में उन्होंने यही कहना है कि तुसी पहला प्रोफैशनल एडवाइस लो और उस तो बाद ये प्रोडक्ट्स का इस्तेमाल करो क्योंकि इन्होंने साइड इफेक्ट्स जोड़े ने वो घट ने और साइड इफेक्ट्स इन द फॉर्म ऑफ कोई रैशेस हो गई या डिटॉक्सीफिकेशन जो होंगी है तो तुहाडे शरीर की जी तुहाडी स्किन हैगी उस दे विच कुछ इरीटेशन हो सकती है, लेकिन वो कुछ समय लिए होंगी है। पर इसके बेनिफिट्स जोड़े ने बहुत ज़्यादा ने और इन्हों का यही कहना है कि हर्बल मेडिसिन जो है वो किसी भी किस्म की जो है वो तुहानूं बेनिफिट पहुँचा सकती है।